if you're doing the workouts, the core exercises, all of it, and your back pain still keeps coming back, you're not crazy. And it's not because you're not trying hard enough. There are 4 really common mistakes that I see women making postpartum that actually keeps this cycle going. And most postpartum workouts are accidentally reinforcing them. Most of the women I talk to think their back pain is just because they're not strong enough. So they push harder, do more, but they just end up in more pain. But it's not about being stronger. We have to think deeper to understand the root cause of why your body is in pain. Pregnancy changes so many things about our body. And you had 9 months for your core to drastically shift. Due to shifts in your posture, hello, gotta make room for that growing baby, which disconnects us from our breathing diaphragm. That's the muscle that everyone keeps talking about that helps you with that elusive 360 breath. That growing baby stretches out your transverse abdominis. So right away, half of our core isn't functioning as well as it could. Then you have a delivery, either vaginal or C-section, and man, that's traumatic no matter how smooth it goes. And then we have to take care of a little newborn while we're trying to rest and recover. And for most of us, we're told we need to wait 6 weeks before we do anything. And then you're just expected to jump right into exercise because you're all cleared and healed. And you jump right back in, expecting your core to start firing, just because the postpartum workout tells you to activate your core. But when you try, it feels disconnected, like you can barely feel it. So you try harder, brace more, which leads to the number 1 mistake that I see, which is not rebuilding your core foundations first, even if you start with the most basic exercises first. But you haven't mastered your breathing strategy, how that connects to your pelvic floor. Hello, your pelvic floor is not a separate entity. And then how to activate your deep abdominal wall muscles with that core connection. When this strategy isn't mastered first, we end up rebuilding a strategy that's unbalanced, which can lead to your back pain because your back is trying to do the job of the rest of your core that is not working well. And you never actually end up building the strength that you're looking for. You just end up in pain after workouts. Now, mistake number 2, you're treating your body the same as everyone else's postpartum. Every woman's body is different. And why your body isn't connecting to your core can be so different than your best friend who also just had a baby that you keep comparing yourself to. The comparison trap is not something I want you to fall into. So please, for the sake of your sanity, stop. You see, some women need more pelvic floor support. Some need more abdominal wall correction. Some can't expand their rib cage, and some are stuck in a flare. The list could literally go on and on. But let's move on. If you follow a program that isn't built for you, you can do everything right and still not improve. The problem isn't that most postpartum programs don't work. The problem is that they might not work for your body specifically. So here is mistake number 3. Expecting random YouTube videos and Instagram reels to magically fix you. Literally every single one of my clients did exactly what you're doing now. I see it every single day. Because you feel like you can figure this out on your own. I see you, Superwoman. But sometimes we do need a little bit of help. But when we have random workouts with no true plan, no logical progression, with someone telling you over and over again to engage your core without actually knowing what that means for you, it's a recipe for disaster. And you end up reinforcing that same dysfunctional core strategy every time you work out. And it creates this cycle of workout, flare up, rest, try again, flare up again. And no one wants that. All right, mistake number 4. So the last mistake I see is doing the same basic postpartum core workouts over and over again without ever progressing or moving forward. We have to move past the basics once we actually get your core foundations right. And we have to train your full body. Motherhood is literally a marathon with children that literally keep growing and demand to be held over and over again. But the jump from those basic postpartum exercises into workouts can't be huge. Your body needs logical progression so it can slowly adapt over time to those changes. But your body does need that load. It needs to squat. It needs to hinge, to learn to lift and to lift asymmetrically because we're always handling a bajillion different loads that are uneven. You need to reload jumping and running. because your kids are getting older and they're running faster and you need to be able to chase them. But we need the in-between, that logical progression from our basic postpartum exercises with the right core strategy into loading your body more. There has to be an in-between so that your back pain can finally calm down. So if you're stuck in this cycle of doing workouts, flaring up your back, resting, and starting over again a couple days later, the problem isn't your effort, it's your strategy. In the next video, right over here, I'm going to show you exactly how this looked for one of my clients, Holly, who thought her lifting days were over after 2 kids and severe back pain, and how she got back to training without pain.